Hello, everyone. Good afternoon. Good afternoon. I hope you're all doing great. Thank you so much for joining us. If you could please take your seats, we're just about to start. We do apologize for the heavy traffic. And then despite the heavy traffic, the gates changed. So we do apologize for that. But thank you so much for joining us. My name is Liz Ntonjira. I'm the Global Communications Director at AMREF Health Africa. This afternoon, we'll be talking about a topic that's really close to all of our hearts, and we're looking forward to the deliberations that will go on. I'll just start off with a few announcements for some housekeeping rules. If you could please put your phones on silent, we'll really appreciate it. The washrooms are on the left, on your left, my right, right outside this exit. Take a sharp right. There is a door. It's closed, it's black. Just push it open, or pull it, and then it's just the first turning to the right and then left. You can't get lost. It's not that big. You'll be able to navigate. The other thing is that we're live streaming this discussion, this session. There are people joining us in the webinar. For those joining us online, please do keep your questions coming. Please take part in the conversation. If you're very digital savvy and you want to share some of these conversations that we're having here, we're using the hashtag AMREF at UNGA 77. So please feel free to share anything that you feel interesting for the people who are not here. There will be a Q&A for the people joining us online. Please post your questions in the Q&A segment of the online version. For the people in the room, you will notice a conference mic on all the tables. You just need to raise your hand and then tap, there's a button, and it will be on loudspeaker. So thank you so much for joining us. I'm gonna hand over to our fabulous moderator of the day, of the afternoon, Dr. Debisi Araba. Thank you so much for joining us.
Well, thank you very much, Liz. Good afternoon, everyone. My name is Debisi Araba. I'm a member of the Malabo Montpellier panel and a visiting researcher at Imperial College at the Center for Environmental Policy. It's a pleasure to be here today. My sincere appreciation to everyone who is here physically and those who are joining us online. For the benefit of those who are online, this meeting will be exclusively in English. And we also encourage you to begin using the Q&A function to put in your questions and comments. These will be attended to during the panel discussion. This event, we of course are grateful to AMREF Health Africa and partners for co-hosting or convening this event to bring stakeholders to discuss the key challenges on climate change and its impact on health. And of course, we want to explore the innovative game changers for creating just, equitable, and resilient health systems. Climate crisis, of course, is an existential crisis. It's a multimodal crisis. It impacts us directly and indirectly. We have the second and third order impacts of climate change on human health and human existence. It doesn't affect us just in Africa. It affects us around the world, as you've all experienced over the last few seasons, wherever you live in the world. You have felt, wherever you are in the world, you have felt a direct or indirect impact of climate change on your personal livelihood. The impacts of climate change, as we're saying, are also evident at the systems level. So it's more systemic, particularly within health services and the provision of universal health coverage, eroding progress towards its three dimensions, being the coverage of the people in need of care, the cost of treatment, and the care of services available. The crisis is also linked to increased food insecurity, which is my forte. And we know that poor nutrition leads to poor health and, of course, brings this vicious cycle to bear. The climate crisis is affecting women and youth disproportionately, and hence worsening gender inequalities with overarching ripple effects on access to education and income, thereby promoting negative social cultural norms. We are trying to build momentum towards COP27 in Sharm el-Sheikh in Egypt, where the world would gather, following on from the meeting held in Glasgow last year, to deliberate and decide how we tackle mankind's or how mankind or humankind tackles climate change systemically and collaboratively. And we are going to hear from world-leading experts today on the different aspects and different facets to what it's going to take for us to build this multi-stakeholder partnership and bring to bear the fierce urgency of now. Now, before we invite our panelists, it is my distinct honor to welcome Honorable Eisenhower Ndua Nkaka, the Minister of Natural Resources and Climate Change, and a Member of Parliament of the Government of Malawi. Honorable Nkaka was appointed Minister of Foreign Affairs in 2020. In January 2022, he became the Minister of Natural Resources and Climate Change. He is a member of Parliament for Lilongwe Mpenu constituency and also holds the Secretary General position for the ruling Malawi Congress Party. Honorable Nkaka has a Master of Science degree in Strategic Management at Derby University in the UK. He also holds a banking diploma from the University of South Africa Institute of Bankers. Ladies and gentlemen, Honorable Nkaka.
Excellencies, distinguished delegates, ladies and gentlemen, good afternoon. Climate change impacts all spheres of life, including human health, and therefore requiring interlinked solutions, most especially now when our countries are seeking to achieve universal health coverage as a target of the Sustainable Development Goals. Extreme weather events affect not only the health infrastructure, but also the individual human health. In Malawi, for instance, climate-related disasters have reversed progress in the health sector due to damage of infrastructure. And climate change has also led to onset of disease burden of climate-sensitive diseases, such as diarrhea, bilharzia, and malaria. For example, in 2019, when my country was hit by the cyclone Idai, we experienced an increase in malaria cases in the districts most affected by the cyclone. Likewise, this year, tropical cyclones Ana and Gombe resulted into increased cases of cholera in many districts. Your Excellencies, distinguished ladies and gentlemen, in the realization of these challenges, my country did not hesitate to be amongst the first African countries to commit to the COP26 health program, now called the Alliance for Transformative Action on Climate and Health, ATACH, which aims at bringing human health at the forefront of climate change work. Among other things, countries committed to increasing the resilience of health systems and reducing the emissions from the health sector. Malawi joined the initiative at an opportune time when it was in the process of developing a health sector strategic plan 3, in which issues of climate change are one of the priority areas. In meeting its commitment, Malawi has started installing solar systems in health facilities instead of installing diesel generators for electricity. Malawi also intends to buy energy efficient medical, let me take that again. Malawi also intends to buy energy efficient pieces of medical equipment that have low carbon emissions. In this way, we will reduce the health sector's carbon footprint. Excellencies, distinguished ladies and gentlemen, the above initiatives build on the interventions my country has been implementing since 2014 under Global Framework for Climate Services, GFCS, with support from the Norwegian government and delivering climate resilient water and sanitation in Africa and Asia project with support from Foreign Commonwealth Development Office, FCDO. These projects led to, among other things, increased capacity of health workers and communities by facilitating the integration of a module on climate change and human health in the curriculum of some health training institutions and communities, and established multi-sectoral health and climate change core team, HCCCT, for coordination. Your Excellencies, distinguished ladies and gentlemen, despite all these efforts, adequate and predictable funding remains a key challenge to advance health and climate priorities at a national level. I therefore would like to appeal for more support towards climate change and health initiatives in Malawi. I thank you for your kind attention.
Well, ladies and gentlemen, once again, a round of applause for Honorable Mukaka. Right now, we have a short video before our panel discussion, and we will cue, oh, okay, no, we will cue that from here. All right. So while the AV logistics are being done, I shall invite our panelists to please join me up front. First, we have Dr. Gethinji Gitai, the Chief Executive Officer, Group Chief Executive Officer of AMREF Health Africa, a passionate advocate for pro-poor universal health coverage. Dr. Gitai joined AMREF as the Global Chief CEO in June 2015. AMREF, of course, founded in 1957. It's the largest Africa-led international organization, reaching more than 11 million people each year through 150 health-focused projects across 35 countries. Dr. Gitai is the former co-chair of the UHC 2030 Steering Committee, a global World Bank and World Health Organization initiative for universal health coverage, and has recently been appointed as the co-chair, Strategic Advocacy Committee, and a member of the Unilever Sustainability Advisory Council. He holds a bachelor's degree in medicine from the University of Nairobi, a master's degree in business administration from the United States International University, as well as a certificate for strategic perspectives for nonprofit management from Harvard University. Ladies and gentlemen, Dr. Gitai. Next up, we have Lois Kwam. Lois is the Chief Executive Officer of Pathfinder International. Under Lois's leadership, Pathfinder is on the move. They're charting a new path while staying true to their mission. They're taking on the new challenges the world faces, whether it's meeting the needs of growing numbers of refugees or meeting barriers to make contraception available to millions of adolescents for the first time. This is the work that Pathfinder does. They're committed partners to the courageous people they serve. Their work transforms communities. Named 3 times to Fortune's list of the most influential women leaders in business, Lois Kwam joined Pathfinder in 2017 as CEO. She's a Rhodes Scholar. She holds degrees from Oxford University, and Macalester College. She speaks English and Norwegian and grew up in rural Minnesota. Ladies and gentlemen, Lewis. Next up, we have Dr. Jenny Miller, Chief Executive Director of the Global Climate and Health Alliance, where she coordinates the joint efforts of national, regional, and international health organizations addressing climate change. The Alliance works to minimize the health impacts of climate change and to maximize the health benefits of climate solutions through leadership, advocacy, policy, research, and engagement. On behalf of the Alliance, Dr. Miller co-chairs the World Health Organization Civil Society Working Group on Climate and Health. Dr. Miller received her doctorate from the University of California, Berkeley. Ladies and gentlemen. All right. And the lady of the hour, Dr. Madeline Thompson, is the head of climate impacts and adaptation at the Wellcome Trust Foundation. Dr. Thompson has over 25 years of research experience at the interface of climate and health, focused on large-scale climate-sensitive health interventions in low and middle-income countries. Her research is focused on the development of new data, methodologies, and tools for improving climate-sensitive health outcomes in a changing climate, with a focus on infectious disease, public health outcomes, and hydrometeorological disasters and nutrition. Ladies and gentlemen, this is our panel for this afternoon. Please give them a round of applause. All right, Madeline, since I introduced you last, and I hope people took the profiles or the bios of everyone, we begin the conversation with you. Why is this important to the Wellcome Trust? So this is new to you. So why climate change and why adaptation?
So let me just, that sounds like that's working. So yes, the Wellcome Trust, which if you are not familiar with it, has for a long time been heavily invested in funding research on human health, medical research, biomedical research, often very upstream transformative research. And as of 2 years ago, it has gone through a major transformation. After a scientific review, consultations all around the world, not only with the funded scientists from Wellcome, but other scientists, the question was raised, is Wellcome funding the science of today? Is it funding the science that we need now? And there was a resounding response, which was, we need to fund differently, and that one of the things we need to fund is climate change and health. And as a result of that science review, the reorganization of Wellcome to support a new mission, which is to use science to solve the major health challenges, and the health challenge vision for climate change and health is really around averting catastrophic climate change in a way that supports health. And within that vision, we have now a mission from the climate team at Wellcome to put health at the heart of climate change action. So the idea now is not so much just the science, but really seeing how science can support change, can support action in country where it's needed most. And of course, this is a big shift in a quite big organization, but I'm really delighted to say that we're starting to be to move forward on this new agenda. We have a director, Anne Dangor, who directs the program. I'm the head of the impact and adaptation aspects of the program. We have 4 goals. The goals are evidence. The first 3 are about the development of evidence for impacts. And I think one of the things I was learning this morning in one of the hub loss and damage sessions is the importance of understanding the impact, particularly in vulnerable communities, so that that impact can be made visible. And to do that, you have to engage, you have to build the information, you have to be able to share that information with people who can then act. The second around adaptation is really around understanding what adaptation support health and what's the evidence that one form of adaptation will last in the longer term. So we don't just adapt today, we look at what are the systems that we will need to adapt over the longer term. We also have a strong mitigation focus, and we understand the urgency question. We have to start with mitigation, and there, how does health help the argument for mitigation? Can we use health as an opportunity to drive action that is deeper, faster, greater scale, by bringing in new communities, by engaging a broader public, by bringing policymakers, another tool, if you like, to convince their stakeholders that action on climate change is necessary now. And last of all, in our goal is we have the aim to build a field, a community, not only of researchers, but practitioners and policymakers that can engage productively in this space. Well, I'll stop that.
Well, wonderful. Well, thank you, Madeline. Well, sort of carrying on from the last point you made, this community of practice, or the sort of the it takes a village approach. Jenny, how are you working across private health institutions to ensure that we address climate change systemically?
Yeah, thank you. So the Global Climate and Health Alliance is an alliance of health organizations that come together to be a voice on climate change and be a voice for putting health at the center of climate action. It was founded in 2011 because there were a number of health organizations that had started recognizing just what a threat climate change posed for health, and started speaking about this issue and started engaging with the climate policy-making process. And they realized they couldn't do it in isolation. They had to come together and join their voices together to make that shift. I would say we are still early in the process of getting health into the center of climate decision-making. But what GCHA does, what my organization does, is bring health professional organizations, health advocacy organizations, individual health professionals that are championing this issue together to try to influence that decision-making. And it kind of goes both ways. There's the getting health into climate policymaking, and then there's ensuring that healthcare and health systems themselves recognize climate change as a threat, build capacity, prepare themselves, and take leadership on the issue. So in the early days of this climate and health movement, if you will, many people who were advocating for attention to this issue felt very alone and were working in isolation. That is no longer the case. And one of the kind of shining examples of how much this recognition of the impact of climate change on health has grown is that last year, ahead of the UN climate negotiations, over 600 health organizations came together and signed a letter to governments heading into those negotiations, calling for climate change to be addressed as a health issue, calling for the key actions that are needed to protect health, not only the mitigation actions, but also the adaptation, financing, investment in health systems. So that letter from the health community worldwide, those over 600 organizations represent 46 million health professionals around the world. So the health community is massive. 46 million is about 2/3 to 3/4 of the health community. So professional societies and associations representing 2/3 of the health community recognize the threat that climate change poses and are willing to come together to be a voice on the issue. There is still a tremendous amount of work to be done, though, because even with that kind of joint statement, health is not really embedded in climate decision-making at the international level. There are many opportunities and much need for the health community to continue to be a voice for driving health into climate decision-making. And a couple of examples of how that's been done, so showing that it really can be done. Last year in South Africa, in advance of the climate negotiations, South Africa had written its revised national climate commitment, which it was required to do. Association of South Africa submitted a public submission on that draft national climate commitment, calling for health to be embedded throughout, calling for greater ambition in mitigation, and the resulting climate commitment, the nationally determined contribution, which is what they're called, did in fact embed health and did in fact have more ambitious climate mitigation targets. And just one more example, in Australia, for many, many years, a coalition of health organizations called the Climate and Health Alliance developed a national climate and health strategy for the country. It consulted with the medical associations and the public health organizations, really a whole of health community involvement in developing this. They brought it to the political parties, the one in power and those that were out of power. The one in power, I don't know how much of you follow Australia, but it's very backwards, and it was very backwards in its climate thinking, was paid attention but did not do anything about it. But the Climate and Health Alliance continued to elevate the intersection of climate and health. And they in fact made it an issue in the most recent election. Australia had faced extreme wildfires. It became a voting issue for people. The fact that the government was not protecting them, their health from climate change became a voting issue. And they kicked out the government and brought in another that is ready to take up climate and health. So the health community has a powerful voice. It's mobilizing and starting to raise that voice. And I think it's absolutely essential that we continue to do so.
Excellent. Thank you very much, Jenny. So we've Lois, we've heard from Madeline one of the pockets of work or packets of work that the Wellcome Trust will focus on is data to improve information. We need the information. We're seeing an organization or the aggregation of stakeholders in meaningful ways. How do we bring the right information to the right stakeholders to achieve our clear objectives of ripening this issue and bringing to bear the fierce urgency of now? How do we target the information to the right audiences? In Australia, as Jenny just mentioned, it was on the agenda, it was on the ballot. So how do we put this on the ballot around the world?
Well, thank you. And colleagues, it's such a pleasure to be here with you today. Can you hear? Oh, son. Thank you, colleagues. It's such a pleasure to be here with you today. We at Pathfinder believe that women and young people are great advocates, innovators, and problem solvers. And I'm pleased to be here with two of my Pathfinder colleagues today, Crystal Lander and Jerry Haruna. And at Pathfinder, we often say that paths are made by walking. We have to walk to learn where we're going. And we have not done very well as a world when we have left out the innovation and the problem-solving capacity of young people and women when we've sought to undertake these significant challenges. And climate change is something that's about us. It's not about them. It's about all of us. We need innovation. We need problem solving. It was so exciting to hear about the work in Malawi. We need it everywhere, in every sector, at every level. And therefore, we need women and young people to be properly supported. And at Pathfinder, we recognize that that starts with access to reproductive health care and strong healthcare services to support them. We know for every one of us, wherever we live in the world, that's where it all starts, so that women and young people can have voice and agency in the world. We know, and your film reiterated this, that women and of course young people are more strongly affected by the effects of climate change. But we are not, as women victims, we are not, with support, we are advocates, we are agents, we are the innovators and problem solvers that the world needs. So we have to have women's voices and the voices as young people in all of these international fora. And you raised, as we were talking earlier, the upcoming COP meeting in Sharm el-Sheikh. We will have a significant presence there. And one of the things we believe is kind of seen as believing. So we're going to show people real live climate solutions that operate at scale and drive gender equity. And I'll give you just the example of one that we're planning to expand in Africa in the coming period. In Aqaba, Jordan, in our partnership with the Sahara Forest Project and the Norwegian Bellona Foundation, That site in Aqaba, which was opened 5 years ago by the King of Jordan and the Crown Prince of Norway, desalinates water, and with that water produces vegetables in the desert. And with that process takes carbon out of the atmosphere, a carbon negative value chain. Who runs that site? Women engineers from Jordan. And there is a tremendous opportunity to expand these kind of carbon negative value chains that deliver on gender equity. And by the way, also on a significant number of jobs and provides food across new areas. We also know that in Niger, our colleagues in Niger, where the desert is expanding, that women in Pathfinder communities have the fingertips knowledge of what still grows where. And that knowledge, which many of them use now at a household level, is the core to the innovation that can address change at a societal, at a national and global level. And so we want women to have the kind of support, the kind of voice that allows for that. And finally, I want to thank you for the research that you're going to be authorizing at the Wellcome Trust, because there is far too little known in these areas. And we have a partnership with the University of Washington's Institute for Health Metrics and Evaluation to look at the impact of adverse climate events on women and girls, so that we can understand how they need to be supported, but also provide the avenues for women and young people to be the problem solvers and innovators in those settings that we need. It is their lived experience. It is our lived experience. It is us that will see us through this. Yes.
Well, thank you. I wasn't sure I couldn't hear myself. Thank you very much, Lois. Ithinji. Yeah. Now you've heard. Can everyone hear me? Mm-hmm. Okay, I wasn't sure. The feedback's different on this microphone. Now you've heard from different aspects here. We've looked at where the impetus is coming from the Wellcome Trust, the alliance being coordinated and formed by Jenny. She's representing 48 million professionals in the sector, and then how we channel all this energy through advocacy for impact. Now, bringing this home to Africa specifically, if you had all these wild horses with all that energy running in different directions, there'll be a lot of energy expended, but we're not moving, or we wouldn't be moving in a predetermined or definitive direction. How do we ensure through your work that we can coordinate all this energy, all this passion, all the verve, the funding, the urgency to achieve our clear objectives? What's AMREF doing?
Thank you. Can you hear me? Is mic, or should I? Okay. All right. Thank you. Thank you very much. First, Debisi, thank you. And I want to say how disappointed I am, because I thought I would have the best socks in the room, but your socks are really just over the top. I had really tried, but clearly you've taken the day, and you're very, very smart. Thank you very much. Rockefeller, I've seen Andrew's suite here. Thank you for facilitating for us to meet at such a beautiful site. Isn't it beautiful? Yeah. It's absolutely stunning. So thank you very much to Rockefeller Foundation for enabling this. And of course, to our partners, Pathfinder, Wellcome Trust, for also trusting that our work can move forward and start to trigger some change in this area that's actionable. And thanks, Jenny, for the evidence you've shared. We may look like we're only about 50 or so, but I hear there are 48 million people with us here today through you. So thank you. Thank you very, very much. I want to recognize some of our members who are actually driving this work. I may sit here and look like I'm driving our climate action and health work. It's not myself, Martin. Thank you for everything you're doing. Martin Mushangi is actually driving this work, and I saw a colleague he's working with called Nyawera. I don't know if Nyawera is still here. Yes, Nyawera is there. So thank you for everything you're doing, and to the entire team that has enabled this to happen. This conversation, I'm reminded in the morning we had actually a Wellcome Trust conversation this morning, and the conversation was on infectious diseases. So that's really the bulk of the work that you're doing. And the point that you're making, the reason that, and I think is Jenny, that the issue about connecting climate change and health is really not caught on. It's because the people driving the agenda of climate change are actually in the global north. It's actually high income countries. And for them, the relationship between climate change and health is really not clear. It's very academic, because you're talking about heat exhaustion, you're talking about some of those things that are really very individual, for example, individual action, and you can take action about it. But when you come to sub-Saharan Africa, we're talking about issues that are systemic. You're talking about Malawi, where I was recently, where because of the flooding, the sanitation collapses, and therefore the sanitation mixes with the water, and the people are consuming the water. And then you have a widespread outbreak of cholera. Now that, you don't have to convince the minister in Malawi that there's actually a difference between climate action and health, because it is system institutional level. And I think that's really what we need to bring to the fore, that it's no longer about individual exertion and skin and this kind of thing. It's actually health system systemic. And that's why, and thank you very much, Minister, for the action that your government is taking and for being here with us to talk about this issue. In the morning when we were talking to at the Wellcome Trust conversation on infectious diseases and what's happening with climate change, a colleague, Fiona from WHO, brought some very humbling statistics. Say WHO Afro is receiving 2 to 3 alerts on health every week, 2 to 3. Then she said 56% of them are climate related. Yeah, and this has to do with malaria outbreaks, cholera now, especially in Western Africa and other places. I mean, we never thought we'd be talking about cholera in 2022, but it's back in a vengeance. Now we're seeing a big threat of the continent on dengue fever, okay? We are seeing, all these other diseases that are viral and everything else that are coming up. It is a real challenge. So we need to move forward to the action where there is evidence, there is data, and actually the policymakers shift the agenda, especially for countries in sub-Saharan Africa, where the contribution to the carbon emission is so low. And therefore, when you go home and you talk to a minister of health and say, we want to do climate mitigation, where do you start? If you look at Africa with maybe, I think it's less than 1% of contribution, it is actually South Africa and Egypt that have 50% of the total sub-Saharan Africa contribution to carbon emission. It's 2 countries, because this whole thing is driven by carbon industrialization. So when you then talk about sub-Saharan Africa and you talk about climate change mitigation, the government doesn't understand what you're talking about. What do we need to do? Because, here we are, we're not emitting much. And we do appreciate that governments are moving forward, like the minister has said, trying to look at changing the way energy is provided. But at a large scale, the bigger impact for sub-Saharan Africa for climate change is actually health. And therefore, the conversation on health and climate change in sub-Saharan Africa has to move to adaptation. That is really what we should focus on. And I think even as we talk to governments, we should move to the policy for adaptation. And what is the package for adaptation? Even as we try and hope and pray that the big high-income countries that are emitting 40% and 50%, including where we are, actually make a change and we can save ourselves. I am actually kind of pessimistic that we will reverse the trend now, that the 1.5 is not going to happen. And therefore, I think we need to take it as a reality that the climate change crisis on health is going to happen. It's a reality. It's not if. So I think we need to plan as if it's here and it's going to continue. We're talking about health, we're talking about hunger, millions of people now being at risk because of hunger. So if we move to adaptation then, which is, and I'm coming to the area you're talking about, is around the areas of health. We are talking about adapting our health systems to be responsive and resilient, not for epidemics. Because I think this is the other thing we need to talk about, because the climate change, we're going to have a lot of outbreaks. And there is a demand that we're going to see with the pandemic treaty and all these other things, with all of us trying to move towards creating a pandemic-ready health system. We don't need to create a pandemic-responsive health system. We need to create a health system that is just and equitable to all, that is ready to respond to outbreaks, but also serving people every day. You know, we have had challenges now with the COVID and even Ebola, and now there's an outbreak in Uganda where we respond more purposefully with more money to pandemics and to outbreaks, but we don't respond the same way for cholera outbreaks. I'm not sure you have had any money for you to respond to the cholera outbreak, Minister, in Malawi. None. But how much money do you have for COVID vaccines? The COVID vaccines are actually in the store. And you're even pushing them down. You're trying to make sure everyone takes them. But you need money for cholera now, but you don't have that. So how do we create health systems that recognize that infectious diseases are going to increase? They're killing 25% of the deaths actually from infectious diseases. And we create health systems that are just and integrated so that they're not just for pandemics. The next thing is, of course, the science that you're talking about and the science that's being done. And thank you very much, Jenny, and also Madeline, for the science that Wellcome Trust is doing. We need that to be accelerated because then it supports our plans on adaptation. Now, for us to do this adaptation, there is a conversation on money. Now, we have talked about providing money from the polluters or from the people actually emitting the carbon to help adaptation in the countries where the impact is, 100 billion a year. I'm not sure where we are. Maybe somebody has more data on, maybe Jenny will comment on this.
We're still short. We have not yet hit the 100 billion that was promised.
Correct. So we are still way short, which means that our adaptation is going to stagger because we don't have the money to do it. And I saw something from AFDB, Africa Development Bank, saying actually Africa needs about 130 billion a year by 2030 to actually implement the adaptation that's needed. And we are just talking about 100 billion a year, which is not there yet. So there's no money to do this work. So the question then is the kind of financing that's needed may have to come from different sources, what we call blended finance or stack financing. You're looking at grants, you're looking at public finance, you're looking at private, which then finally comes to your question, Debisi, that we cannot do all these things we're talking about. Adaptation requires agriculture, requires natural resources, requires environment, education, energy. It requires everyone in the table. The financing requires multiple people. It requires private sector, is bringing government together, and all these people and civil society, because at the end of the day, the response is founded on the people-centeredness. And that is what you're talking about, Jenny and Louise as well, that the people are the center. Because you know what, today there's flooding in Pakistan and in other places. People are not waiting for us to come from Rockefeller University to go and tell them what to do. They're actually responding as we speak. Even now, wherever there is this action, people are responding. Malawi is responding to cholera, people are responding. So the question is, how do we actually build the resilience of the people, not ourselves in the global space, of the people so that they know exactly what to do and they're supported to implement their actions. So for us as AMREF, we are looking at how to bring people to the center. How do we bring people to the center of the conversation? How do we bring communities to the center of the conversation? How does the government actually, through national and subnational led policies, become actually where the adaptation is happening, not just at the global health space where we are, which is really important for the advocacy and policy and the movement. But at the end of the day, the tangible action is going to come from national and subnational level. So here we are talking therefore about multilateral partnerships between governments and the multilaterals bringing the money together to be part of the financing and the thinking and the research. We're talking about multi-sectoral partnerships because we need to bring all the different sectors together. But we're also talking about multi-stakeholder partnerships, private sector, public, and civil society to all come together. But what do they do? So next year, we are going to host in March. We are going at the Africa Health Agenda International Conference, which is hosted by AMREF. We're going to actually, and committed this, to hold a conference on integration of health into climate action and what the role of communities is, and we are going to be there in March. So that's a commitment that we've made, and we will be carrying that out in March, and we hope to see all of you there. Thank you.
Oh. So for the benefit of those in the room, I had queued up the panelists with a key, a code word if they overrun their allotted time, but I got lost in Kefinji's words, and I forgot what the code was.
It was a cough, and you did cough.
There we go. Now, the Africa Health Agenda, March 2023. So all roads lead to this.
Kigali,
Now,
yeah.
but before 2023, climate change has immediate impacts right now. And this next question is for all panelists. So we will go through this. We're talking about the fierce urgency of now. We will have, there will be expectations in the lead up to the agenda and the integration of health and climate action. We have three broad areas. There's the politics. Politics needs to change. Finance needs to change. Advocacy needs to change. So what's missing from existing effort? Is it the type of finance? You've talked about, you talked about blended finance, more innovative finance mechanisms. Do we need to see even more innovation? Is it the type of finance or the quantum of finance available to get this work done? Now, is it external financing? Is it internal? Do countries like Malawi need to rejig their budgets? Are we looking to talk about some percentage allocation to budgets again, as we did with education, food security? Or are we looking at something more systemic in approaches to financing, both public, private, and the combination? And the second thing is with advocacy and politics. What type of politics will get us the solutions we seek? Negotiations have been going on. We know that, come November in Sharm el Sheikh, it's not that, people arrive in Egypt and then on the spur of the moment come up with something. Position papers have been pre-cooked, are being worked. We have thousands of people probably in darkened windowless rooms around New York here who've been working on fine-tuning every single comma and Oxford comma and apostrophe in every document. Are these negotiators, are they armed with the right data, with the right information? And do they feel that there's the energy for change and for action beyond another gathering of world leaders in public and private sector come Egypt? Are we going to see something transformative in bridging the divide between health and climate change? What's your expectation for Sharm el Sheikh? And what needs to go in now? Say some negotiators on their 5-second sandwich break now from the darkened room. What do they need to hear right now? Adeline, do we begin with you?
Okay. So first of all, last year, last year, WHO was in the Blue Zone with their own pavilion. That was the first time they'd been present there. And I think they had a fantastic series of events, etc. Welcome is supporting them again for COP27. And so WHO's presence there brings health into a really core venue. Obviously, we need to go a lot further than that. I wanted to just pick up on the adaptation issues that you raised, because I think we're talking about Africa and adaptation is the key thing for Africa. We have to then say, well, when you're going from the sort of large scale down to the national, subnational, etc., adapting to what? Exactly. You need to know what is going on in a locality. You need to know what are the likely futures for a particular place. They're not all the same. And I just want to reference Honourable Makaka's comments. Maybe not everybody realised he mentioned the GCF, the Global Framework for Climate Services. When we talk about climate, we have to partner with the climate people. And that is something that health people often forget about. It's a very important thing, not just at the UNFCCC long-term big negotiation side, but at the practical level in country for the adaptation agenda. So I think getting those partnerships really clear that we need a practical solutions and from our perspective at Welcome, it's really about identifying the research that is needed to make that work at a local level. So I think that was a key thing that I wanted to bring.
Yeah, I mean, I think one of the things that climate decision makers don't realize when they're approached by health people is that the health argument for climate change actually can help them get the job of addressing climate change done, because the solutions to the climate mitigation can bring health benefits. climate adaptation can make climate action more acceptable to people who are being impacted by it. And so I think in the past, we've often gone and said, pay attention to health, pay attention to health. We're now really emphasizing in our interventions in COP and our approach to COP, talking to climate decision makers in climate language. Like, how is health relevant to the hard decisions that you're here to make? But also not backing down from centering it on these are real impacts for real people that are happening now. And I think one of the things that is so powerful about health professionals in the health community and health workers of all kinds is that when talking about climate change, they are trained they're scientifically trained. They bring knowledge of the evidence base. So the research that Wellcome is funding, health professionals are equipped to be articulate about that evidence. But at the same time, they're working day in and day out with patients and communities. And so they have stories to tell about real people. And then if that's paired with the voices of those people from the communities impacted, that has the capacity to shift the frame and shift the narrative. So I think we need to be savvy about our policy interventions. So we've made submissions into the UFCCC process from the health community, but I also think we need to reframe the whole conversation with stories about real people backed up by the evidence.
Stories about real people backed up by the evidence. Very good interventions. Thank you, Matthew. Thanks, Shani. Lois?
I love that. Stories about real people backed up by real evidence. Natalia Canham said the other day that about 10,000 women will give birth in the flooded regions of Pakistan in the next 3 months. To your point about when your time comes, you can't wait till there's a conference about that, right? And I think that I think those real stories that the moment is now, that there will not be good health globally without action on climate change. And I think we also have to infuse that discussion with some hopefulness and optimism. And so that sense that we have about seeing is believing, the way lives of young people and women can be changed when they're supported, the way that leads to really concrete innovation in the healthcare system, whether that's, solar panels on health clinics that we know are so powerful, whether that's regenerative agriculture in desertified areas, that mix of stories and evidence, and then a hopefulness, like we can do this if it's about us, if it's about us together.
Okay. Now, you know you're next, and as we're pulling this together, I have this burning question in my mind, and maybe this is for the audience. Do you not consider the professionals on this panel as climate change leaders? Do they have to work in meteorology, or would you? Perhaps it's a framing thing. Maybe we haven't stepped forward to say, I am a leader in climate change. You are bringing influence to the decision, because a metaphor of climate change is rain, right? If we say climate change is like rain, it touches everyone, literally, and it will touch us. And human health is that. That's the ultimate consequence. If it impacts human lives, it's health, and if it's health, climate change. So perhaps are we by definition defining ourselves as outsiders? You think? Is there a way to become more inclusive in how we define ourselves and the work that we do?
The question you're asking is complicated, but let me try and simplify it to say that no amount of data and research can replace lived experiences. So anybody with a lived experience in this area is actually an expert, because they're saying this is, my mother, I think I was telling Jeremy in the morning, I say, if I ask my mother about climate change, she has no clue. What is that? She's 87, can't speak English, speaks, but she can't, this conversation here, even if I try to explain to her, she'll ask, what is that? What were you doing about that? But if I ask her about has the general weather changed? And how has that changed her life? When I did ask her that question in my conversation with her, she said, you know, she has a bit of coffee, like 200 bushes of coffee. And it's on that coffee that she knew every month around this time, I would harvest. And when I harvest, I'm going to receive money around this time. And I use that money to pay school fees. She now says she cannot tell when she's supposed to harvest. So she's given up on her coffee. Now that's her expression of climate change. So the question is my mother an expert in climate change? No, but she's an experienced person on the climate change impact. So we need to keep in mind that the lived experiences have to support the evidence, and the evidence has to be supported by the living experiences because they're indispensable. But they're the ones that are real, and that's back to the stories that we are talking about here. But the question on what is missing, I would like to comment on that, is I have actually never seen the world respond with money like they do when there is a disease of global health security. Never. The amount of money we've seen on COVID is unbelievable. I mean, we avoid, we need money for health systems. Suddenly, trillions of dollars have been spent. Ebola, when we had Ebola in West Africa, how much money went into it? So much money, because it is of global health security concern. But when there is a cholera outbreak, when there is cancer is killing 40,000 people, no one really is for that. So I want to appeal to my colleagues who are in research. How do we actually position the health and climate change as a global health security issue? Because if we do, because of course the emerging and emerging diseases are going to be global health security, then the world will pay attention. I think we need to frame it as a global health security issue, not just climate action adaptation in Africa, because they're like, Africa, okay, fine. I mean, we have had monkeypox in 1970, so it's all right. So global health security issue, that's number one. I think we need to position it with that dimension. The next issue is that I don't have a lot of faith in the document that's going to be signed in Egypt as the previous one that was signed in Paris and all this. Because, I have been involved in negotiating for Universal Health Coverage Declaration. And that's when I saw how sanitized the process is. You don't end up with anything because it's so sanitized to fit everyone's, interests that what you end up with is not useful to anybody. The US struggled to remove the word rights from the UHC document so that they can say, you can't have abortion and all this because we removed rights. And that took ages to agree, and we never agreed, actually, by the way. Finally, they didn't sign it. So what I have more faith in is country-led action. And I think that's what is missing in Egypt. The question is, how do we support country-led action for climate? Because it is the countries that know exactly what's going on. So we can focus on that for the global declaration and communication. But at the end of the day, the next day after we leave Egypt, we must ask ourselves, what is the country-led action on climate action and health?
Thank you very much, Gitinji. We have a couple of questions from our online viewers. Thank you for participating in this engagement. Liz is going to read out how many questions? Do we do it two questions at the same time?
So I'll take them back to back.
Okay.
So they're really following the conversation online as we are in here. So there's Ismail who says, I'm Ismail, a university student pursuing Bachelor of Public Administration at Mzumbe University in Tanzania. My question is, as it is well known that climate change affects the social and environmental determinants of health, including clean air, safe drinking water, sufficient food, and secure shelter, as the time keeps moving, the climate change is expected to cause approximately 250,000 additional deaths per year, from malnutrition, malaria, diarrhea, and heat stress. What could African governments do, and what role do university students, the youth like myself, have to play in this? Over to you, Debisi.
Okay, I'm going to break protocol and extend that question to Honorable Mtaka, because we have in the room the Minister of Environment and Climate Change. So, Honorable.
the issue about climate change must involve everybody, all hands on deck. So it doesn't matter whether you're a student, a professional, a politician, we are all equally affected. And getting back to Africa, he who wears a shoe feels where it pinches most. We are going through real impact of climate change. Like you said, here you could be talking about the heat wave and you could have solutions to that kind of problem. But when Cyclone Idai hits and it sweeps away entire villages and health centers and the schools and the roads and everything, then you are brought to the realization that climate change is real. And I'm talking about students. He asked a good question. As a student, what role could he play? I would put him in the class of admissions, help us bring real data, not just academic data, that will inform decision-making. And decision-making has to be localized. I don't know whether I've answered all the questions or both the questions that he answered.
Ismail, I hope you're still listening. You had the rare opportunity of having an indirect conversation with a cabinet minister from Malawi. And to underscore this, Honorable Minister, we would like from now on for African heads of states to declare climate change a global health security issue. It's not just an existential crisis. Perhaps that makes it abstract and far removed. If we bring it to health, and we bring health to the center of the issue, perhaps then these trillions of dollars that keep magically appearing from the money tree, will make themselves available, and maybe the world's commitment to collaborating becomes even more real and tangible if we connect it to health.
Yeah.
Liz, second question, please.
Yes, the second question from an anonymous attendee is asking, we're seeing enterprises and profit-making businesses measure their GHG emissions. What are non-profits making to account and offset their GHG emissions? And also, what is being done to mainstream climate action in health programming?
Okay, so greenhouse gas emissions, GHG. Lois, do you want to take that? Yeah.
We've recognized that we have to make changes in how our organization works to be a part of this. And we've changed our financial strategy to incorporate ESG measures in that. We also found that one of the biggest sources of greenhouse gas is, of course, travel. And our travel patterns changed a lot during the pandemic. And lo and behold, our services increased and things worked very well. And it really, we have moved away from having the headquarters of the United States. As I was telling you, we don't have that anymore. We've shifted to having presidents based in Africa and South Asia, and moving decisions closer to where the impact of those decisions are is pivotal. Is exactly as you said, the lived experience is vital. And so that has to happen close to where it works. And that means less of the historic kind of travel that has happened in these fields.
Thank you very much, Lois. And not to leave you lovely ladies and gentlemen in the room out of the conversation. If we have questions, could you please just raise your hand? And I believe Liz will find you. Do we have a roaming mic? Yes?
Actually, a mic
all right,
in
from
each
the
table. Yes.
Yeah, I'm a Luddite, you see. I belong in the 20th century. So please make use of the microphones on your table and go ahead and ask your question.
Can I?
Yes.
Okay, testing. Everybody can hear me well? Okay, fantastic. First of all, thank you for the marvelous panel. It has been a great experience, I guess, for all of us attendees. My name is Leticia Campos. I'm a visiting graduate student in the program in Global Surgery and Social Change based in Harvard Medical School. And basically what we do is that we advocate for safe, timely, and affordable surgical care for the 5 billion people worldwide that lack access to surgical services. Most recently, we have been researching and advocate between the intersection of climate change and surgical care, because we came to an understanding that surgical services are energy consuming, waste generating, and therefore they contribute to the healthcare environmental footprint. And on this sense, I would like to ask the vision of all of these speakers on what is the role of the surgical workforce in mitigating and adapting surgical systems and health systems as a whole to climate change. Thank you very much.
All right, thank you very much. We'll take the second question.
It's not a question, by the way, it's just a comment. I'm Daniel, Minister of Health from Rwanda. I'm so happy for attending this conference, and I want to thank organizers, AMREF and Rockefeller Foundation. It's extremely important to see that at least health now, we are talking about health and climate change. Because we ministers of health, we are like to manage consequences of what is happening out of our system, out of our sector. You know, when there is increase of temperature, at least to give some examples in sub-Saharan areas or wherever you have this kind of consequences, when there is increase of temperature, for mosquito, the cycle is changing completely. From eggs to adult mosquito, the duration is shortened. It's like we have massive, big quantity of mosquito nets just because today we have the rise of temperature, especially in this part of the world. As a consequence, mosquitoes are there to transmit malaria. And for mitigation, we are the one to suffer for getting additional nets, mosquito nets, to proceed with indoor radio spray, very costly intervention. It's good that today we are in replenishment with the Global Fund to get additional resources to fight malaria. Hope we'll reach this 18 billion. But part of international solidarity, we should really try to see how in all these treaties that we are signing to make sure that resources are secured to mitigate consequences of climate change as far as health is concerned. Otherwise, we should not wait necessarily investing for global health security pandemics like Ebola, COVID, as we said it, cholera, malaria. These things, probably people are not feeling it as global health security challenges, but at one point it is. Because poverty, it brings migration. It brings all of these things that finally will affect even West countries. Thank you.
Well, thank you very much, Dr. Ngamije, and thank you for your intervention. As we had discussed earlier, it is climate change is now a global health security issue, and you are a climate change leader. And so we're hoping, even while you're here in New York, you bring this urgency to bear in your discussions with partners, and also in the lead up to COP27. The discussions shouldn't be in silos. It's not about a health situation or climate change situation or environment situation. In September last year, Honorable Minister, we hosted a global food system summit where the conversation moved out of food value chains or just food security and looking at the ecosystem around food. I think we need a similar systemic approach to ensuring that we are not, like I said earlier, defining ourselves out of the room. I think we are in the room, we belong in the room. Climate change affects health, it affects humans, and so it's a health security issue. And so you are on the front lines of fighting climate change in Rwanda, and we thank you for your efforts. Liz, do we have any other questions online before we come back to the room? Okay. And we are coming to you.
Yes, we have a question from Philip Ochen from Kenya, who says the issue of lived experiences is sufficient to explain to the masses the extent to which climate change affects and impacts health of the masses. My question is, for how long are we going to continue signing articles that are not changing the effects of climate change that subsequently the health of humanity?
Okay, I think Githinji, you kind of touched on that earlier. I want to now come to the panel on the first question. So Letitia Campos had asked the question: what is the role of the surgical services in mitigating climate change? Do we have any strong responses?
I could make an initial response to that. So health systems, I believe in the opening remarks, it was mentioned that, yes, the Honorable Minister mentioned Malawi's commitment to the COP26 health program, decarbonizing and making health systems resilient. There have also been private health systems for many years that have been committing to decarbonize and to make their environmental footprint healthier. In England now, the NHS has committed to achieve net zero in its health systems, I believe by 2040, and then impact its supply chain. All of that kind of work requires the expertise and innovation of the practitioners themselves, as well as the support of the practitioners themselves. So healthcare practitioners are in the best position to know how to change those systems in ways that reduce the environmental footprint while maintaining or improving, in some cases, the level of care. And so that is the role that surgeons can play, is to look at their own practice and look for those opportunities to make changes. So that's one of the places that I would start.
So just to add to that, the health community is supported by the health research community, which is where a lot of the innovation is happening. And it's a big concern that the carbon footprint of the medical research community is also substantial. And so in a way, that's kind of affecting the supply chains to the health system itself. So welcome, we're looking at the moment about what is the carbon footprint of the medical research community, which of course includes us. And we have to decarbonize our own institution as well.
Wonderful. Okay, so we'll take our final round of questions from the room, beginning there. Okay.
Yes, so my name is Lavran Musa from Ghana NCD Alliance, and also with the Global NCD Alliance. Right. So indeed, I must say that I'm so happy about this conversation. I'm actually an advocate on climate change. You know, in my part of the world, including Africa, indeed, there's a complete link between health and climate change, especially with the Ministry of Health. You know, you hardly found discussion in my country where the Ministry of Health is involved. But of course, looking at what has gone on today, you notice that indeed there's a need for that kind of integration. There's a need for that kind of multi-sectorial, you know, because climate change obviously is a cost-cutting issue. And also, you also recognize the fact that it impacts on non-communicable diseases, you know, and that's why in the framework of the UN in 2018, if I'm not mistaken, where they roped in, you know, pollution as part of, to be included in the 5x4, so now 5x5. Just for us to know that indeed climate action is very important, and there's a need for our ministries of health to, as much as they can, to be included in climate talks. Because without that, I don't think that we'll be able to achieve the objective that we have all set, because we cannot always live with the environmental ministry. Meanwhile, the Ministry of Health plays a very critical role in whenever the epidemic, you know, eventually occurs. The NDCs, for instance, when it was developed in Ghana, the Ministry of Health was virtually not present. It was only done by a siloed ministry, like the Ministry of Environment, and which, of course, but so I want to urge that indeed, as we continue the conversation, let us rope in the sector ministry, special ministry of health in all of these discussions. Thank you.
Correct. Thank you very much. And this is why we are convening this gathering. Next question.
Hi, good afternoon. My name is Wadzanai. I'm with the Rockefeller Foundation. Thank you so much for this panel. So I actually want to build off of what has just been said around NCDs. So as we talk about climate change, I always hear about dengue fever, cholera, and so forth. But to me, these are low-hanging fruits. I'm not saying that they're not critical. They're very critical, but they're also very cheap to treat. I mean, cholera is 5 cents. You mix water, sugar, and salt. You have your ORS solution. Very easy to treat. But no one's talking about non-communicable diseases. And to me, I think there's a very clear line between climate change, urban migration, and lifestyle diseases. If you take Kenya, for example, 1 in 3 deaths are from NCDs, and that number is rising. So my question to the panel is, how do we bring NCDs front and center to these discussions?
Thank you. Next question.
Hi, my name is Rachel Moreski. I'm at Mailman School of Public Health, Columbia University, and I direct a program called SIDHEART, Strengthening Emergency Systems, working on integrating primary care systems at the district and sub-district level with emergency care systems. As my 2 colleagues behind me mentioned, integrating systems, thinking about like a rural road traffic injury, requires a collaboration with the Department of Finance, Department of Disasters, and also the ministries that deal with infrastructure like roads. And so we understand that climate change is so very multi-sectorial, right? And that not only does it require kind of a continuum of care from the community who's noticing a change in coffee to seeing climate emergencies at the health at the health posts, the health centers, all the way up to the district hospitals that are seeing heat-related emergencies, more malaria, cholera emergencies, and how the emergency sector, whether it is a an outbreak or another communicable disease like or road traffic or an obstructed labor, how the integration of climate change is throughout the continuum of care from that socio-ecological model. And so I come to my question, kind of going back to thinking about how systems are funded, and to the funding question that I don't think was fully answered, is that when we think of vertical systems and horizontal systems, thinking back to how other programs like in Ethiopia and Mexico really incorporated a diagonal system, how can we think from organizational levels? Because we know most of health systems is actually funded by the countries themselves. And we sit here in development assistance for health, we talk about decoloniality, but actually most of the funding is not from development assistance for health. So how can we as organizations at different levels within ministries, without externally, to do that true integration within health systems to make sure we're meeting the non-communicable, the communicable? Because we know when we talked about the original 4x4, it didn't meet the needs of the poorest billion for most NCDI. So how do we make metrics around research and implementation that meet those needs? Over.
Thank you. Next question.
Good afternoon, and thank you for this great panel. I'm Rob Walk. I'm the U.S. Board Chair of Amaranth Health Africa, and I'm a healthcare impact investor. I think we all agree on the absolutely consequential nature of climate change and the threat it poses, as well as the key importance of universal healthcare access and the fact that the two are clearly linked. But my question is, all these solutions are great, but at the end of the day, it comes down to funding. And no matter what you do, you can add up all the totals in the world. I don't believe that there's enough money in governments to solve this problem. Not even close. You're talking about hundreds of billions of dollars a year to do some of the things you're talking about for climate change and healthcare access and mitigation in sub-Saharan Africa alone. So how do we get the private sector, which has to be part of the solution, to commit to significant amounts of funding for mitigation for long-term health and climate solutions? How do we get organizations like the World Bank and the IMF, who are great at funding disaster relief, but don't seem to want to fund mitigation and creating long-term solutions? So what is the solution for funding? Because without that, none of this can happen.
you. Final question over here.
And hi, my name is Andrew Fulham. I'm Chief Strategy and Innovation Officer at JSI. And I actually want to build on both of those last two things. The first one is actually a comment to the health community. We often talk very much about universal health coverage and everything, but we often then quickly go to myself, I'm an HIV expert, and I want to protect my turf, and I want to put my story out there as the most important. So particularly as we go to talk to climate experts, remind ourselves, as much as our passion is in certain areas, it is about the universal health coverage, because we all very quickly get into what is important and and so that's something among ourselves, because often we don't do a very good job within the public health community of talking to each other and learning from each other. Immunization and HIV don't really talk to each other. We don't really always do the best job of that. So as we move forward, how can we do some of what we do differently? And to the other comment about private sector, also private sector as manufacturers of product. We've got injectable family planning methods. We've got to have injectable PrEP coming out. We've got bed nets. We've got all sorts of product. How do we change how product is put together and think about the design and the delivery of those so that they can mitigate environmental impact in the use of these life-saving things? And we have to get the innovators around the table early on so that we don't end up with thousands of vials and plastic things that we have to burn in order to make safe.
All right, thank you very much. So for the panelists, what I would like for you to do is pick whichever question that you feel most competent in responding to, and respond. I will run through them again. I'm conscious that our honorable ministers might have other meetings. So if at any point you need to leave, we thank you for your time. We thank you for coming, and we appreciate you. We will be wrapping up shortly. So Honorable Mukaka, Honorable Ngamije, thank you very much for coming. Thank you very much for representing your government, and you're doing Africa proud. And we thank you for being on this table, because this is the exact conversation that we're hoping happens, where the Ministries of Natural Resources and Climate Change is discussing with the Ministries of Health. So perhaps you will be returning to the UN building with some innovative approach to the country-led strategy that Githinji talked about. So we're looking to African countries for the innovation that we can support and we enable. Thank you very much. So to the panelists, Wadzi talked about this nexus, climate change mitigation, lifestyle diseases, looking at how to bring non-communicable diseases to the center of the discussion. I'm just running through the questions, and then please take them as you feel led. Emergency services, how do we respond to shocks? How do we integrate these responses and ensure that they're not in silos and they're more integrated? Funding, not enough in governments. We don't, no government in the world has enough in public funding to address these challenges exclusively. So we need the collaboration. We need more innovative financing from the private sector. What incentives do we need to get the private sector on board at all spheres? And also the multilateral finance institutions and the development finance institutions. What is it going to take to get them to provide the funding or the enabling environment for innovation to thrive across these countries? Then how do we talk better amongst ourselves, amongst the multiple subsectors in the health community? What is it going to take for us to be more collegial in our approach to addressing this existential crisis? So I hand over to the panelists, please. Who wants to speak? Just raise. Madeline?
Okay, well, I just thought that some of the work that we've done, I can't think and Mike at the same time. Some of the work that we've done already in our previous smaller initiative at Welcome really tried to look at some of the challenges that have been raised here, and that is systemic thinking around preventative health, which has a climate environmental lens. So one example is that we have a randomized controlled trial happening in Fiji, which is looking at water systems and investing in water systems and natural nature-based solutions. We have city-based initiatives where looking at mobility, easy access to walking and cycling, etc., improves health, reduces carbon. Food systems, better diets, which improve health, reduce carbon. So I think we have to look beyond the health system as well as within the health system to see where the interface of climate change and health occur.
I'll pick up on those remarks because I was also going to take up the non-communicable disease question. And I think it's that's one of the places where the hard distinction between adaptation and mitigation solutions starts to break down, and also where the stark distinction between what's the needs in higher income countries and the needs in lower income countries. As Madeline was suggesting, air pollution is a huge driver of non-communicable diseases. It's one of the principal causes of cardiovascular disease. We all think of respiratory disease from air pollution, but it's a huge driver of cardiovascular disease. Unhealthy diets and lack of access to healthy foods, healthy sustainable diets requires rethinking our food systems, not only to mitigate climate change and reduce the carbon footprint, but also so that we're growing foods and able to grow the foods in places that lack nutritious food and lack access to the foods that they need. Similarly, physical activity is a huge driver of non-communicable disease or illness or health in that realm. And the kinds of solutions that would address those problems means sort of redesigning our cities and rethinking our food systems and rethinking our energy systems. And those solutions are solutions that can make communities more well adapted, can reduce carbon emissions, and can address some of those non-communicable diseases. How we finance them, that's a different question that I don't have an answer for.
The common thread through all the questions is the urgency of now. If we wait to address climate change and the impacts of health until the usual pattern, and you shared some of your experience with that usual pattern of international collaboration, we will wait until there are just major, major catastrophes that affect the nations that the funders work in, and that is too late. We need to bring as a community the urgency of now, that this work needs to happen now. And there's a hopefulness if we can get it underway now. And what are the pivot points to that? Well, the pivot point is to listen to people whose lived experiences are close, to admire what they know and the wisdom that they know, and see them not as victims, but as problem solvers and innovators who can help us find solutions that can move to scale.
Thank you. And Honorable Minister, thank you very much for being here. Minister Ngabije is going to be co-hosting the Africa Health Agenda International Conference in Kigali with myself. So thank you for being here, and therefore you can invite as many people as possible into Kigali. We'll actually be our host in Kigali. So thank you for being here. And now you can hear, we'll actually have a side meeting also on climate change and health, community-led and also integrated, so that we integrate it to whatever else is going on. So it's not something that then becomes a siloed. The financing, the issue on food systems has been discussed. So I'll just comment on two things. One is, what do we do with all the articles? I think it's one of the questions that was asked. We must nationalize the articles. Whatever we sign up here, we must then go back to the country and say, what does this mean for us? And there are many things that don't mean anything. Then we pick what means, what pays that, we want to pay attention to, and then convert that into national plans. I think that's the only way to move from advocacy to action. Now, on the issue of financing, which is a really difficult one here, the one thing I want to say is that we are holding COP27 in Egypt. Egypt, as I said, is one of the highest carbon emitters in Africa, next to South Africa, 16% in Africa, but has no Paris Agreement commitments, zero. And that's why we are holding COP27. So there's a high level of unseriousness generally with the mitigation side. I think that's what we need to agree, that countries just say, wait for us to industrialize, then we'll discuss how to cut back, because you industrialize first. So you want us to cut back our industrialization. So there is a high level of unseriousness on the mitigation side. So what are we going to finance then? Because I think that for us in Sub-Saharan Africa, the biggest issue is how do you finance adaptation? And also for countries like South Africa and Egypt that are trying to transition there's also that area that also they need to be helped to transition. So more recently, I was reading something on South Africa signing the Just Energy Transition Partnership, which was between private sector and governments. Yeah, so there is a financing model that's emerging. The JTP is actually coming up where countries can actually sign up for the just transition, so that if South Africa is going to abandon coal, for example, how do you abandon the coal and move towards green energy? That requires a lot of money. And how do you ensure that the communities affected are actually protected against vulnerability, because the transition is also affecting communities. So these are sources of money, which is blended, multilateral, local, domestic, and also private sector. And a good example I could think of is JETF for South Africa. But the financing challenge is real. Yeah. Thank you very much.
Well, ladies and gentlemen, please give a round of applause to our honorable panelists. Now, as we bring this to a close, and I promise we are bringing it to a close, I'd like to invite each panelist, based on what you've heard, whether it's an evolution in your thinking, more questions on your mind, just a short sentence or two on what we should be asking of ourselves going to COP27 and beyond. What should we be asking of ourselves, or what should we be demanding of ourselves? What more should the people in this room expect from the entire community? Is it more financing, more innovation in the financing, more urgency in our advocacy of actors, state and non-state actors, etc.? Well, Vithinji, since I always ended with you on each question, I'm going to start with your, or are you writing a preamble to your 2-minute? That's fine. I'll start with Lois. And then
At Sharm el Sheikh, we're going to have a terrific presence in our Pathfinder Egypt team. We've been in Egypt for 35 years, and I have expanded our work there significantly. And we're going to focus on, seeing is believing, on showing the carbon negative, regenerative agriculture, gender equity work that has been underway, that has achieved real results, that now we need to take to scale.
We'll be there, so we'll meet you there, Louise. I think that the demand should be that the nationally determined commitments should actually be nationally determined. The challenge you have is that governments will see it and say, and then send over. The civil society, and we're talking about multi-stakeholder, multi-sectoral, they should actually be involved in the NDCs. And we have seen that even for everything, governments determine and send, but they are not determined nationally. I think if that's done, then we start to develop national plans, because the NDCs are then private sector, government, civil society before they are taken to the COP. So the NDCs should be truly national.
Jenny?
I think some of what my organization has committed itself to going to COP this year is to, in every way possible, work health into the conversation across sectors and build relationships across sectors, and build that kind of articulation of health, not as something separate, not as something that needs to be held apart, but that is something part and parcel with the solutions that we need to seek. And we're doing that through developing policy talking points that are really looking at the agenda items in the negotiations and thinking about how health is relevant in those negotiations and those conversations, and also working on placing health speakers in sessions at other pavilions with other sectoral conversations happening. So we're really creating that dialogue. What I think we want to hold ourselves to account with is just to keep going. We can't stop. We can't afford to stop. The urgency is real. The problem is not going to solve itself. And we have, as the health community, a duty and a responsibility to the people we care for to keep pushing.
Okay, thank you. So welcome will be at COP. I think our primary role there is actually to support our partners not to lead, but to be really part of and learn about the community in particular. We're new as an institution in this space. We also, I think, as a philanthropic institute, we're talking about financing. Philanthropic financing is for a particular purpose. We're not government. We can't do disaster response, etc. But we do want to learn where the innovation opportunities are, where the catalyst opportunities are. And I think quite often in adaptation, people tend to think that that's not really very innovative. So it's not exciting. You can just, you just need more stuff. You just need to do more of whatever you do normally. And I would like to understand that differently. I would like us to learn about opportunities for innovation and investment so we can catalyze change in adaptation, as well as what we see happening on mitigation. Because I think in mitigation, we absolutely see that. So we're really wanting to learn. And if you have ideas, you wish to share, etc., we'd love to hear them.
Wonderful. There's an Ethiopian proverb that says, when spiders unite, they can tie down lions. So to all the spiders in the room, metaphorically speaking, of course, the onus is on us. In our respective spheres of influence, we can collaborate. We have influence, we have our voices. For those who might have lost their voices, it's time to find your voices. And for those who have their voices, it's time to strengthen them and amplify them. But it's most especially time to unite, because together, or shall we say united, we stand. So this can be solved. And I thank you all for your time, but more especially, thank you for giving this august panel of speakers the opportunity to share their thoughts and their wisdom with us this afternoon. Ladies and gentlemen, the panelists. Okay, and now I invite Ms. Liz Ntonjira to give the vote of thanks.
Thank you so much. Another round of applause, a huge one for our panelists. Thank you so much. And for our moderator of the day, Dr. Debisi, who forgot his cue. So I hope he doesn't forget he has a flight in a few hours. A huge round of applause to him. Thank you so much. I'd also like to thank each one of you for attending this session. Like he said, united, we can do a lot of things. And also to the people who joined us online, who kept the conversation going in the virtual spaces, we thank you so much. To our honorable ministers, thank you so much for staying on till this time. We really appreciate it, and we look forward to AHIC 2023 in Rwanda. And to our honorable minister who left and gave us our opening remarks. I'd like to mention that the postcards on your table are actually yours. You're free to carry them, as well as the USB drive. The drive has a lot more information about the work that Amref Health Africa does, the lives that we impact, because I strongly remember the statement that says, stories of real people backed by real evidence, because that is the heart of the work that we do at Amref Health Africa. The USB drive has more information. It also has a deck of how you can partner with us at AHIC 2023 between 6th to 8th of March. And we're really looking forward to hosting you in Rwanda together with the Ministry of Health in Rwanda. That's it. Please enjoy. The floor is open for some pastries, some tea, coffee, water. We do have only 20 minutes, unfortunately, to interact and network. But thank you so much for all the brilliance and for the engagement that you've shared with us. And a huge round of applause for the team that put this together. Thank you so much, the team that worked tirelessly hard to put this together, and to our partners that continue to support our work. Thank you so much, and have a beautiful evening. Thank you.
Thank you.